When I spoke to Dr. McHugh the very first time, I instantly felt a connection that this was the right person. My name is Siglinde R, and I'm from Germany. And I came to the United States 50-some years ago. Since I was very healthy all my life, I never expected to have a problem, what I have right now, called scoliosis. Over the years, it started very, very little, the pain, and I could deal with it. And over the years, it became worse and worse and worse till I saw myself forced to see a doctor. And he told me, the problem, and he told me that down the line, I probably would have to have surgery. But I told him I wasn't ready yet. I thought it wasn't necessary. And as the years goes on, I felt like it was necessary because the pain was unbearable.
So I had the pleasure of taking care of Miss Rieg several months back. Such a sweet woman with a really bad problem in the lower spine that is not uncommon. So current data suggests about 60% of people over 60 will have some type of degenerative scoliosis. So if that's you and you're living like Miss Rieg was living, know you're not alone.
Walking straight wasn't even in the picture anymore. So I'm looking forward, to get a surgery done, hopefully, which will restore the quality of life and me being able to feel like a human being again and not like something, not normal.
Her condition had gotten quite severe, and for anyone who is unaware, scoliosis is sort of a curvature in the spine, and this is a model of a full human spine. And when it curves in this direction, that's a scoliosis. When it curves forward, that's a kyphosis. Many times it's both. We call it a kyphoscoliosis, which is what Miss Rieg had. That will leave you listed forward and to the side, and many people will stand up and be stuck in that position. When you get imaging on folks like her, this is her CAT scan, you can see the severe curve as a result of the years of arthritis that have built up and broken the spine down over time in an asymmetric pattern. When the spine, which is really the main structural aspect to the torso, breaks down like that, it becomes difficult to ambulate, constant pain and pinching of nerves in that region, and your overall quality of life starts to really decline.
I used to take my bicycle every day. I like to go out. I went for my pilot license, and I couldn't be up there, and then having pain. As it got worse over time, I came back in here, and this is when I saw him. My regular doctor told me about this place, and thank God it was him.
Surgically speaking, she's a little older than the typical patient. Our data shows folks 75 and older have an increased risk, but it's a case-by-case analysis. She was very active, had a lot of energy, had reasonable bone quality, and sometimes this is prognostic, had a willingness to take on this kind of a challenge. It's a bit of a recovery that takes a lot of energy, and you have to be willing to put the work in, or you're not going to get the recovery you'd wanted. And she was very steadfast in her desire to get her life back.
You're going to have a different person sit here,
Fortunately for her, we took her to surgery. We do these cases fairly frequently. Ultimately, you're putting hardware, screws in place into the individual vertebrae to act like anchors, and then you're using long rods to basically pull the spine into a straight position that's ultimately supported by these long rods that I call them railroad tracks because you have two on both sides. When we take a look at Miss Rieg's before and after pictures, you get something that looks like this. The X-ray is really hard to see when the version of it that doesn't have the hardware, but what my eye picks up is this severe curve throughout the lower part of her spine, and it's what we're trying to show you here on the CAT scan, and we want to straighten that out. This picture is after surgery, and we've got screws in every vertebrae, and we've used these straight rods to pull that curved spine straight and overall improve her posture.
I'm telling you, what a difference, you know, I couldn't wait to get my normal life back. And you know what, let me tell you, I'm not the type who likes to be restricted anyway. And you just become a different attitude. And maybe trying to get my hobby back, going back to flying. You know how it is up there being all alone, just you in the airplane? And you just feel free.
Yes.
And I don't think if I had the pains I had before the surgery, I don't think I would have been able to do that.
So one of the whole reasons to do the job and why I became a doctor, and it's what keeps you coming back to these difficult cases. If people weren't getting their lives back and improving the way she did on a regular basis, we wouldn't be doing this. That is a common position for the folks who ultimately choose surgery. I usually tell my patients, you know, most people who are ready to commit to something like this have a list or a litany of things that they can no longer do. The condition has just robbed them of the things that bring meaning to their life on a daily basis. And the other thing I try and highlight to people is chronic pain. And if you look at some of Ms. Rieg's preoperative videos, you know, walking around hunched over and off to the side, that's just a very painful way to exist in the world. Chronic pain can really have a major impact on your mental health and sometimes go unnoticed because it's a very insidious, incremental progression. And you become isolated, non-mobile, and ultimately depressed. And when you can turn that around and get the things that bring meaning to you back, frequently you'll see patients get their mental health back as well.